When folks hear about childhood trauma and about our work, often what they think of first is what I call big T trauma. One big bad thing that happens in a child's life that changes the course of their development. While that's certainly true for some of the little ones we serve, what's much more common is that the children and families we partner with experience chronic adversity and toxic stress that stems from systems of oppression and the instability that results from generations of community trauma. Poverty, housing and food insecurity, racism, all of these things create toxic stress for little ones, for their important grown-ups, and for our community. We know from the science that this little t trauma, named not to minimize its impact, but to acknowledge its repetitive daily nature, has a significant and sustained impact on bodies and brains, particularly early in their development. Why I do this work is a little messy. I'm a clinical researcher by training. I was trained to look at the data, and there is plenty of data to drive coming to work every day in an organization that is committed to supporting the mental health of our youngest community members. But honestly, what drives me is a deeper held belief, a belief that is backed by data for sure, but also lives in my own body. A belief that is driven by my experience as a mama, as a daughter, as a therapist who has spent many hours sitting with little ones and their important grown-ups in moments of great pain and uncertainty. This belief is the knowing that each of our experience as babies and toddlers lives on in our bodies. We typically don't have words for these earliest experiences, but they live in our body as adults, in our sense of safety, in our capacity to trust, in how we connect with other humans. Because of that, early childhood mental health happens everywhere. It is not just the business of therapists. It happens in homes, in classrooms, with grandmas and grandpas, in the pediatrician's office, at the park and grocery store, wherever children and families are. I am driven to do this work to make children's mental health all of our business, central to our goals, our responsibility, and the core of our community.